Physician-assisted suicide, what it is, and the pros and cons of the debate. Firstly, physician-assisted suicide is a doctor intentionally giving the means to a patient for them to commit suicide at the patient's own request. So this is the doctor giving the right dosage of medicine to a patient to help them commit suicide in a hospital and with the help of that doctor. Now, physician-assisted suicide's main premise is to end suffering in terminally ill patients. So before things get really bad for a patient, before their illness takes them under and they are still lucid, they ask if the doctor would help them commit suicide rather than face all the pain and to end suffering before it starts. And it is also a way for the patient to be able to say goodbye to their family and still be lucid and be the way that they have always been before they go, so they can say goodbye and say anything they want to their family in their last few moments, rather than the last few moments being filled with pain and being filled with a bad state of mind. So the debate is whether or not it's ethical for the doctors to help their patients end their own life, which is a big question to ask, because there's a lot of cases where physician-assisted suicide has been helpful, but then it is also still taking somebody's life with a doctor's help. So it is very controversial. And a lot of people wonder if physician-assisted suicide isn't allowed to happen and the government forbids it or makes it against the law, then is the government interfering with the end-of-life decisions? So the pros for physician-assisted suicide are firstly that it gives people the right to choose their own death rather than suffering at the end of life. So if a person is terminally ill and they're going to die, these people are able to make that choice prior to their death in order to help prevent suffering in the future and in order to say goodbye to family while they're still lucid. And a lot of people believe that everybody deserves this right if they want it. It also lets the terminally ill pass on happily with families present, rather than them maybe going months or weeks, continuing to get worse and worse and worse, and eventually not even being lucid while they are about to die, while they're on their deathbed. And so then they would still be in their own character and in their own mindset when they passed away, and they could treat their families in saying goodbye as such. And then lastly is it would save family medical expenses, because rather than having the terminally ill person stay in the hospital for lengthy periods of time before their passing, and that passing being prolonged, lots of people would rather just get it over with while they can still be happy and healthy and die with their family surrounding them. And also that earlier death would save families medical expenses that they then would not be responsible for paying, because the family member would not be in the hospital as long. Now, here are the cons for physician-assisted suicide. Many people believe that it is akin to legalized murder, since it would be assisted suicide, which could be considered murder. The doctor giving the patient the drugs to end their own life could be considered akin to legalized murder. Another con is that doctors take an oath to do everything they can to save patients, and if a doctor were to help a patient commit physician-assisted suicide, then that would be against the oath, because they are not helping save the patient, but they are rather ending the patient's life. And then a big one is that suicide is against very many major religions and ethical beliefs. So this physician-assisted suicide could go against many, many religions and a lot of people's ethics as well. And then the last con is the fear that physician-assisted suicide could be misused by crooked doctors who could potentially say somebody wanted to commit physician-assisted suicide, but rather use it as an excuse to help them commit an unwanted suicide. So that was my presentation about physician-assisted suicide and the pros and cons to each side of the debate.